A woman who is 20 weeks pregnant calls the clinic because she is experiencing pink tinge discharge for the first time. The nurse should advise the patient to dash. A. Decrease her activity level. B. Call back if the symptoms have not subsided in 24 hours. C. Call back if she experiences an increase in pelvic pressure. D. Seek medical attention immediately. E. Make an appointment to be seen tomorrow. The answer is D. Seek medical attention immediately. This woman could be experiencing preterm labor. A 20-week pregnancy is not considered viable. She should be seen immediately to determine if there is a cause such as cervical insufficiency, premature dilation of the cervix. Hannah is a 21-year-old woman who is presenting at the emergency room for severe vaginal bleeding. She is 32 weeks pregnant. Upon further examination, she is found to be suffering from abruptio placentae. Which of the following assessment findings would be of least concern to the nurse? A. Shortness of breath. B. Decreasing blood pressure. C. Bleeding from oral mucosa. D. Small red dots on the skin. E. A tender uterus. The answer is E. A tender uterus. Abruptio placentae is a serious condition where the placenta inappropriately and prematurely detaches from the uterus. Women with obstetric complications such as abruptio placentae can quickly develop disseminated intravascular coagulation, DIC. DIC is a clotting disorder in which the blood inappropriately clots. Severe bleeding can also occur as clotting proteins become scarce. Symptoms of DIC include blood clots, and bleeding into the tissues such as the skin and oral mucosa. A decreasing blood pressure is concerning due to the severe bleeding caused by the combination of DIC and abruptio placentae. Shortness of breath could indicate the presence of a blood clot. Although uterine tenderness is of concern, it is common with abruptio placentae and does not indicate an immediately life-threatening condition. The nurse completes a cervical exam on her laboring patient. She determines that her patient's cervix is 1 centimeter in length. How would the nurse describe this length? A. 50% effaced. B. 30% effaced. C. 100% effaced. D. 25% effaced. E. 25% effaced. The answer is A. 50% effaced. The normal cervical canal is 2 centimeters in length. Effacement is the thinning of the cervix as the body prepares for delivery. Thus, a 2 centimeters cervix is 0% effaced and a 0 centimeters cervix is 100% effaced. The nurse helps the healthcare team to deliver a healthy baby girl. Upon delivery of the placenta, the nurse notices that it is not 100% intact. What is the nurse's first concern? A. Infection. B. Deep vein thrombosis. C. Pulmonary embolism. D. Hemorrhage. E. Tissue perfusion. The answer is D. Hemorrhage. If the placenta is not whole upon delivery, a piece may still be present in the uterus. This inhibits the ability of the uterus to shrink in size and may cause hemorrhage. The missing piece needs to be located immediately. While monitoring a laboring patient, the nurse notices that the fetal heart rate at baseline varies from 110 to 145 beats per minute. The nurse's first action would be which of the following? A. Decrease IV fluids. B. Have the mother bear down, C. No action is required. D. Turn the mother on her left side. E. Administer oxygen at 1 liter per minute via nasal cannula. The answer is D. Turn the mother on her left side. Marked fetal heart rate baseline variability of 25 beats per minute or more may be cause for concern. Similar findings may indicate that there is poor oxygenation of the fetus. Turn the mother to her left side, to increase perfusion, and notify the physician. Note that this is still in the normal range for fetal heart rate for a laboring patient, about 130 beats per minute, and that the low end of this spectrum is of slightly more concern.